So looking back at the program, I did not know how interdisciplinary the program was, and it's actually very expansive. When I first started, I really thought it was just like crunching data and numbers, but it really goes like well beyond that. Like you're looking at policy making, ethics, behavioral health, like every part of healthcare. So my advice to anybody thinking about doing this program, definitely come in with an open mind like I did, and feel free to ask any questions from any students that have gone through that track before you, and then ask like professors on like different aspects of this program. So I used to work at McGovern Medical School in pediatrics gastroenterology, and one of the projects that we did work on was how probiotics affected children with autism. And every time I like go through class and I talk about either like the public health aspect of it or even the biometric aspect of it, like I think back on that project and I'm just very excited about like where it's going to go, and I think about like everything that I'm learning can definitely be applied to that. One thing that really did surprise me about the program is how supportive and collaborative it is. When I first came into the program, I really had no idea what I was doing, and so a lot of the deans and heads of the program really helped me acclimate to the situation. And then also at the same time, like I am enrolled in an online program, so I was kind of a little nervous about like how to meet other people and things like that. And they offer a lot of opportunities. Like I just went to a dinner the other day and I met a whole bunch of like classmates and students that were ahead of me. So they really were able to support me in my decision making and goals. So that's one thing that I was really surprised about. This program has challenged me, inspired me, and has prepared me. Like if you're thinking about getting into this program, definitely do it, because it's way more than just a degree. It'll definitely change your life.
Hi, my name is Sabella Meckley, and today I will explore why a Master's of Science in Biomedical Informatics with a Master's of Public Health or a PhD in Biomedical Informatics with a Master's of Public Health is the right fit for you. At McWilliams School of Biomedical Informatics at UTHealth Houston, we collect, process, and convert data into actionable information, knowledge, and intelligence to improve 1. Healthcare delivery, 2. Patient outcomes, and 3. Aid in disease prevention. We offer a variety of our programs online, in person, or via hybrid modality, whatever fits your schedule best. We offer a wide selection of degrees and programs, including a PhD, a DHI, which is a doctorate in health informatics, master's degree, both a research and an applied track, our graduate certificates that highlight topics like public health informatics, pharmacy informatics, biomedical informatics, dental informatics, and more. We also offer a variety of dual degree programs such as the MDMS, MS MPH, and the PhD MPH. Let's talk about our 2 unique dual degree programs. The MS MPH is a great fit if you're planning to work in the field as a practitioner or researcher in the public health sector. You'll learn how to use information science and technology to track disease support, prevention efforts, and design public health interventions that make a meaningful impact. If you're looking ahead in your career in research and want to shape health outcomes at the systems level, the PhD MPH may be a better fit. This program focuses on turning data into insights, assessing community needs, and using evidence to guide decisions and influence policy. Both programs provide a strong foundation in core public health areas like epidemiology, health promotion, policy, and of course, environmental health. What sets them apart is the integration of biomedical informatics, giving you the tools to develop solutions to improve population health. Whether you're focused on prevention, intervention, or long-term systems change, these programs will help you lead with knowledge and act with purpose. The value of combining the MS or PhD degree with the MPH degree comes as students learn about data interpretation, knowledge management, and how to collect, process, and transform data. Some of the benefits include concurrently enrolling in both degree programs so that the duplication of course content is minimized, time and costs are reduced, and lastly, earning 2 graduate degrees from their respective schools and/or institutions. When it comes to shared credit hours, the MS-MPH has a maximum of 16 credit hours from the student's MPH program that can be transferred into the MS degree. And for the PhD MPH, a maximum of 36 credit hours from the student's MPH program can be transferred into the PhD degree. The integrated schedule gives students a flexible path through the program with multiple start points depending on when you begin. Whether you start in the summer or the fall, the MS-MPH plan is designed to reduce overlap, keep coursework balanced, and help you move efficiently through both degrees. The PhD schedule is more extensive, but it also follows a clear progression from foundational courses to qualifying exams, advanced research, and dissertation work alongside shared public health coursework. This is a quick overview of our degree plans and what they look like. On the left is the MS MPH plan, which includes core classes like public health informatics, scientific writing, and a practicum, plus electives that round out your training. And on the right is the PhD MPH plan. It builds on that foundation of advanced public health coursework, research design, and a dissertation work, along with a dedicated focus on both SBMI and public health shared courses. Our application deadlines are as follows. For the MS MPH, we accept applications 3 times a year, summer, fall, and spring. Our spring deadline is November 1st, our summer deadline is March 1st, and our fall deadline is July 1st. For the PhD MPH, we accept applications twice a year, the fall and the spring.
Our spring deadline is July 1st, and our fall deadline is December 1st.
Like your Texas Common App, we utilize a centralized application service called GradCast. The application is online and it's $38, where you will provide all your supporting documents and materials directly to GradCast to be processed for review. 3 letters of recommendation are required, a goal statement where you personalize it and talk about how you would encompass the coursework, and then all of your official college and university transcripts will be sent directly to GradCast to be processed. We strongly encourage you to review our admissions requirements webpage. You are more than welcome to scan the QR code for more information about our programs. Feel free to contact our Office of Academic Affairs for more information about our dual degree programs.
The modernization of public health and the re-architecture of population health management services that are demanded by the needs of our societies right now require a new kind of thinker, one who can interrogate new data sets, emerging data sets, and can simultaneously think through the impact that could fuel communities for decades to come. So that new kind of thinker will be the professional who powers advanced surveillance systems or digital community services or care coordination services that exactly fit the needs of our patients and public. So going beyond the traditional silos of disciplines and mending together the fragmented care models, that's what this new program would result in. Be fluent in both code and public health context, because innovations usually come from intersectionality of disciplines, one who can appreciate the power of data and the frontline needs. So connecting the back-end data infrastructure with the frontline community needs, that's what is needed and that needs to be appreciated. That they are going to be the system architects for public health in the future decades, especially with the rise of artificial intelligence and related technologies in our societies. It's important for folks to understand how these technologies should be rolled out in a more human-centered manner, and these trainees get to do exactly that. What excites me the most is that these trainees will become leaders who don't just follow technology trends, but who can transform those technologies to power care services that can yield better health outcomes. Someone who can toggle between abstraction and application, someone who can observe where friction is and then does something to fix it, and who doesn't hesitate to learn something new, and willingness to be the agent of change is an important characteristic. And finally, to embrace the messiness of all the large-scale data sets that they likely play with, and also the messiness of public health infrastructure itself, to be able to embrace it and to be able to try different approaches and dissect those problems using non-traditional lens is very important, and willing to fail and fail forward, I think will define success in the domain. Thank you.